Hello students, let's quickly revise modified widman flap. This technique offers the possibility of establishing an intimate post-operative adaptation of healthy collagenous connective tissue to the root surface. It provides access for adequate instrumentation onto the root surface and immediate closure of the area. Now let's see steps. As we all know, initial incision will be internal bevel incision, and the bevel should be directed toward the alveolar crest starting 0.5 to 1 mm away from the gingival margin. Next incision will be in the gingival crevice. It will be known as crevicular incision. The last incision it will be made in the interdental area, and the granulation tissues will be removed. We can see in this picture the granulation tissue, or this is the lateral wall of the pocket. It contains all the inflammatory component that is there in the pocket wall. Now it is removed. Later on, tissue tag granulation tissues are, once they are removed, we'll be doing thorough scaling and root planning of the area. And then flap is thinned to allow for close adaptation to the gingiva around the entire circumference of the tooth, and it is approximated. And the interrupted direct sutures are placed in each interdental area. This is post-op picture. Now let's have a comparison of pre-op and post-op. We can make out the result after the lateral wall of the pocket is removed, and the same thing we'll be seeing in the video.
Hello students, let's quickly revise steps in modified widman flap. Initial incision will be internal bevel incision. That means bevel of the blade should be toward the alveolar bone. Next incision will be crevicular incision. That means the bevel of the blade will be in the gingival crevice. And last incision will be interdental incision. So let's see in this video. The initial incision is an internal bevel incision to the alveolar crest starting 0.5 to 1 mm away from the gingival margin, and we should follow the scalloping pattern of the gingiva. Like this, we should follow the scalloping pattern of gingiva. Now the next incision will be crevicular incision, and it is made from the bottom of the pocket to the bone, and the triangular wedge of the tissue will now be removed. This is also known as the lateral wall of the pocket. Now third incision is made in the interdental space, coronal to the bone with a curate or an interproximal knife. And the gingival collar is now removed. Later on, the tissue tags and granulation tissues, it will be removed with a curate. Root surface will be thoroughly checked. Scaling and root planning will be done. All the granulation tissues tags will be removed. The flap may be thin, and the interrupted direct suture will be placed. Thank you.